I just feel like as IMGs, we're constantly feeling like we have to prove ourselves, and we have that kind of like, we're just still kind of like, oh
Good morning, guys. Welcome back to the Gosey Guide. Today we have a surprise guest, or a special guest. We have Natalie Gordon.
Hi.
She's a current intern resident here in California, Santa Barbara. But I'll allow her to introduce herself.
Hello. I'm Natalie. I guess Dr. Gordon now, but still full of imposter syndrome. It's real. But I'm originally from Houston, Texas, and went to Ross from 2016 and just graduated in 2020. And then I moved over here, actually drove over here from Texas to Santa Barbara. And now I actually just this Friday just passed my first month as an intern. I survived. I'm still alive, you guys. Still alive. So
awesome. One thing we do have in common, aside from going to Caribbean school, we're both Longhorns.
Hey,
so hook 'em horns, hook 'em horns. So I guess we'll start off with our first question is, what's one thing you wish you knew before going into internal medicine residency?
I guess what I wish I would have known is that it's okay not to know anything. I think with just being a medical student, you're always wanting to make sure you have the right answer, that if they pimp you, that you know the right answer, you do your best on exams. But with just this past month, putting so much pressure on yourself to know everything, especially at the beginning, isn't really that helpful. And I remember I used to think I needed to read like all these things to prepare myself before, but nothing really prepares you for your first year. Even if I were to have studied things, you really are there. You're not in school anymore, which I'm trying to remember to tell myself. You're not trying to impress anybody for a grade. You sign your contract, you're doing a job. So now you're just focused on training that job. And when you first start in a job, you don't really know anything, and that's fine, but you're working now, so it's okay. So that's would have been one thing I would have liked to kind of just, you know, preface before and be like, look, it's okay, you're learning, it's okay if you get things wrong, and it's fine. So, yeah.
That's good. Why did you choose IM?
Oh, me?
Yeah.
Well, it's interesting because when I first wanted to go to med school, I thought I wanted to do surgery, but that was my first rotation, and I learned real quick. I didn't want to stand doing 10 hours a day, doing procedures. I still like doing procedures, but I felt like with internal medicine, it's really intuitive, and there's a lot of guesswork that comes with it. You're having to interpret the labs and go off of what the patient's saying and kind of get to the bottom of why a patient's having their disease. And I just like that type of puzzle work that it takes for it. And I also like talking with patients in an acute setting. I like talking to them every day. I like the fact that I can order labs, I can do order whatever medicines on the patient right then and there. I have access to all the nurses. If I need a consult, everything's right there. So I just felt like it's just, everything that I need in a job. So, and I'm liking it so far.
On an average day of IM, can you kind of walk us through what your normal day would be like as an IM resident?
Yeah, so I guess I'll talk through my first day. My very, very first day, I was on long calls, super busy. But essentially, I would come in the morning and I would pre-round on my patients, which for me, I ended up getting there, depending on how many patients I would get. Like for the first day, I have maybe 6 patients. So I would get there maybe at 5:30, 6. And I would just look up the labs, look up the notes from the night before, write all that down, then go see all my patients. And for my program, we have morning report in the morning before rounds. So that's at 7:30 every day. They give you breakfast, which is nice. But I try to get all that done before then. And even during rounds, I'm still kind of preparing my presentations for the attending. Yeah. And then around 8 or so, that's when we actually do table rounds, and we discuss all our patients with the doctor. Just kind of get some of the finishing stuff done for people to get discharged, and then you put whatever changes into medications for your other patients that are still there, and then you're pretty much just finishing up notes, and you pretty much go home after that. I know there's some on the long call day. I'll take new admissions. They break it up. Like the first short call, they'll take patients in from 7 to 3. So while that person's taking patients, I'm just finishing my notes. And then on long call, I'll take patients from 3 to 8. Then after that's done, in the meantime, since I'm on long call, you actually do like sign out from every single person that's in the hospital. So all the other residents, they give you their patients. You have like 30 patients that you have to know information about. You have like a paper, but anytime the nurses call about those patients, you're the one on call, so you have to know. So actually, that's the most interesting talent that we had to know, is to how to really give concise information to the person on call to make sure that they know the basics of what's going on with your patient, so that they know whenever they call you that you know what to order essentially. So after I'm done taking calls, I take admits and everything, then I can finally go home. And usually that first day, sometimes I'll go home at the latest maybe 11 if it's on a Friday. But the other time I was on long call, I went home at like 8:30. So it wasn't too bad.
So I know a lot of people were, you said 30 patients.
Yeah.
Everybody's like, what? How do you?
I know.
So how do you transition from, being a fourth year medicine student where you have like maybe 3 at max to 7 all the way up to 30 patients? How was that? How was that transition for you?
After my long call day, that was the first time that I ever had 7 patients. And for me, I mostly had 3, maybe at most 4. Mm-hmm. So I was like, oh my gosh. And it wasn't like orientation, they don't really prep you for it. It's just all survival mode, I mean, I think up to 4th year, you've dealt with these cases of patients before. You've dealt with heart failure, COPD exacerbation, pneumonia. So you've dealt with all those patients. So for the most part, you do have that baseline knowledge of what the treatment is for each patient. The only difference is you don't really know every patient in depth. But if you need to, you can go through their chart and know it. So mostly it's all, I think, a lot of organization when it comes to presentations, making sure you have their basic background and like their overnight events and like their labs down, and anything outside of that you can look it up. But that also kind of trains you to know what information is pertinent to now, and then what information is just extra that maybe as a student we thought was important, but it's really extra information. Mm-hmm. And I think that's going to be something I'll have to like keep developing, like what's going to be most important at this admission versus, as a student, like knowing everything, which it's impossible to know 7 patients at a time, let alone when we're attending, we're probably going to have to know 20 plus patients at a time. It's impossible. So, but yeah, it's all survival mode, but I think it's like a lot of just organization, making sure you have everything organized and prioritized, which that first month, it was definitely a lot of trial and error. But, but then again, that goes also maybe with my program. They're just very patient and they understand that it is a big jump. So even if there's times during the presentation when they ask you something and you don't know it, there's no pressure. It's not like they're gonna, get rid of points from Gryffindor or something if you get a question wrong. Like, we're just working, you know what I mean? So it's fine. They'll like, they understand, and that's what I felt more comfortable too. It's like if I don't know like something about a patient, they're like, it's fine. So.
I know it's been your first month here in your internship. Is there anything that you found very rewarding?
Very rewarding.
Yeah, thus far.
I think just, of course, when I said originally about the whole imposter syndrome, like, of course you feel like, you're still a student, but there does come a more sense of responsibility, and you just feel so grateful to then have offered a little bit step up in the hierarchy. For instance, we had like a student with us our first month, and of course I was running around with my head cut off most of the time, but it was just nice just to be able to, that she kind of looked at me in a way of like an authority of like, hey, so I have a question about this patient, asking me questions, and I'm like, really, me? Or even the nurse. I remember that one time I came in for a TB patient and we're checking her chest tube, and the nurse was like, oh, I wanted to make sure that you're looking at this when I change it, because they take value in like that you're the doctor now and that you're an important part of the patient's life essentially, so they really want to make sure you have this information. Or even one time, whenever I left, I wanted to leave my shift, but it was again the amputee patient. Their family was there, and I went to go stop by the patient, and then they actually didn't have much information about I guess the surgery. So the nurse was like, hey, if you want to go talk to the patient, here's my chair. And you're like, wow, I'm the doctor now. Like, I actually can actually talk to the patient about the procedure and actually explain what's going on, and the actual parent, the loved ones, they actually take in consideration what I'm saying. They actually really have a lot of weight to it now.
Yeah.
So it is kind of scary of having that authority, but just those instances, I just feel like after all the hard work you've done, people actually respect you a lot more. And I don't know, I'm like coming to really appreciate it a lot. So,
That's
and it's
awesome.
nice to knock off some of the med students from your computer when you're working on it. So it's always nice. You haven't,
That's my chair. Get
so.
up. On the same wavelength, kind of the opposite. Has there been anything that you found very challenging in your first month here?
Other than dealing with 30 patients on my first day, no, I'm kidding. I would just say just the knowledge gap. I know, of course, I said originally that it's okay for you not to know anything, but there's definitely been times when I feel like I should be doing more, and I know I'm at the beginning, but you just want to always. You're still stuck in the student mindset of wanting to be the best you can be and knowing every answer. I think it'll just come with time, just getting more comfortable, and being more humble too, of knowing that you're not going to know anything, and this is a growing process. You're going to get knocked down for some of your thoughts, like, as far as patient management, but that's okay. It's okay for you not to know everything, and just opening yourself to the opportunity to learn more and to be taught. I think that'll, dissolve with time. But that's definitely hard for me because I definitely like to be a perfectionist and be great at everything. And it's very humbling to know that you're pretty much like on the same level. I mean, I've even had, other US students, I have people from UCLA, from Duke, everybody else, no matter what baseline of med school, we're still on the same level. We still have to be taught the same. We still have so much we need to learn. Maybe they have certain skills, but it's just, we're starting from baseline again. So.
Have you noticed, or at your hospital, I heard that you said that we're all at the same level, but being a Caribbean medical student,
yeah,
is there any differences that you've noticed between either work ethic or even how you're being treated?
No, we're at the same line. I know that on one of my I may be like other people, they maybe been exposed to different things, but for the most part, we're all at the same lane. A lot of us are all staying late. We're all getting our notes done the slowest can be. None of us are super quick at everything. Even somebody who's like, we have a couple prelims too. Like they, are going into other fields than I am, but even for them, they're like having a hard time, like not remembering things either. And we all kind of forget that some of us come from Caribbean schools and everything, but we all can come together and just talk about. I remember this one part in like the resident lounge. Everybody's like, "Does anybody know what we're doing?" No, I don't know what I'm doing. None of us know what we're doing. We're like, and it was just such like a great bonding moment because we come from all different types of schooling, and we're all still just going through this whole year, just like trying to figure out what we're doing. Trying to learn, but that's been nice because you're always like wondering like, oh, are these people like super US students, like super like smart and fast? Nope, we're on the same playing field. We all don't know. So
that's great to hear, especially as we're applying, and there's always that little bit of self-doubt, coming from a Caribbean medical school. As an M3 and M4 yourself, was there something that you would have wished and told yourself, like you should do this or you should not do this? If you're looking back, kind of reflecting on how your M3 and M4 years were?
Probably wouldn't have been as hard on myself.
Lighten up a little bit as you study.
Yeah, lighten up a little bit. I definitely would have. Yeah, I think that would be the thing. I think I had a good balance, and that's what I hope to bring in residency. I definitely studied hard, but then I definitely went out. Yeah. I mean, within, out with friends and, just I had a good balance. I studied hard, played hard. I saw a lot of different things.
I like how you said balance there, because I know me and Yaz, that's a big thing that we really try to stress on is balance of life and studying, and not having medicine be your only thing in life.
Yeah.
So that's really good to hear, that seeing the results of that balance.
Yeah.
Fruition into
I know,
Dr. Gordon here.
Still, yeah. I think that's something, just like making sure you have that foundation your third and fourth year to those like habits of like keeping a balanced life and making sure you do have stuff outside things that keep you de-stressed because you don't think a lot of that stuff is gonna play. You kind of like, yeah, whatever, drink water, relax, sleep. No, but like when you're actually there 6 days a week, long hours, and you get home and you do actually need to fall back on those basics of, okay, what did I do before residency to like really relax, talk with friends, like how do I de-stress, things like that, because they're important. You don't think they are, but then once you find yourself kind of stressed, you kind of have to make sure you go back to your baseline again.
Yeah.
So
that's awesome. So I know we're kind of nearing that question that everybody's really wondering here is, how was your board scores? How did you do?
Me?
Yeah.
Okay, now I can talk about it. It's a match. So my step one, I got 227. That during I think step one, I felt like I don't know, I didn't really develop a lot of my studying techniques until I got to step two. I feel like step one, I focused a lot on reviewing and just not really focusing on the questions or applying the answer. Which I'm super happy about my score, but that's kind of what into the first score. I do feel like the first time around, I think I studied for like 4 months or so. And then I did a whole bunch. I think I did like first aid, and I also did like pretty much UWorld and stuff. But then step two came around, and I pretty much just sticked with UWorld. I only took like a month off to study. I studied a little bit during my elective, and then a couple weeks into like the straight studying. And I felt like I really, really got like a good round studying technique. And I got 248.
That's awesome.
And for me, I was super like happy because I at least wanted to break the 230s and maybe in my whole dreams, maybe 240. I was like, maybe it possibly can peak around there. And I got 248 and I was like, wow, it makes me feel like, wow, I can actually, I learned from step one, I was able to kind of overcome that. So, and even like going way back to MCAT, I mean, I've just never really been a good test taker when it comes to these long exams. So for me, I was really proud of myself. So.
We're proud of you too. That's an awesome score. 21-point increase in your score. That's really good. And also that I can see that that's probably a testament of that balance and like.
Yeah.
Did you feel that you being in the hospital and your rotations that you did kind of help prepare your clinical knowledge for your test as well?
I think that, and then just keep doing active learning as you go. Every time I would have a patient, learning it, like maybe reviewing it when you get home, doing questions as you go in like bits and chunks, and then also just building that self-confidence too. I feel like the first exam I was constantly doubting myself of the answers and whether I actually really knew the material. And whenever you doubt yourself, that also plays in like how your test goes. So I feel like going through not only your experiences, your patient experiences, making sure you're reading up on them, but also getting like more confident in yourself. Of course, there's a lot of information. You're scared that you're gonna forget it, but I think those two things like really helped my score. Just making sure like, hey, I don't need to review the same thing 50 million times. I know it, you know it, and keep it going. So
that's awesome.
Yeah.
So Natalie, how many places did you apply to, and how many interviews did you get?
Okay. So for me, I applied mainly, and I knew for me, I didn't want to go anywhere north.
Stay with
at all. I think after being in the Caribbean and the beach, and then being in Miami on the beach, I knew I wanted to be on the beach. So my places were California, Texas, Florida, and then I also, okay, I'll tell you my number, then I'll show you my breakdown. So I applied to 105 only because I felt like my score was the average amount for internal medicine, like the average score, So I felt like I was good with I didn't feel like I needed to apply for 200 like most places tell you to use an IMG. But I would say out of the 105, there's maybe 30, 40-ish that were kind of just thrown out there just to hit the 105. I didn't feel comfortable going through that first round like of sending applications without being at least at 100 for an IMG. In my head, I just felt like I needed to at least apply for 100. So there was a couple those that I probably wouldn't have even applied to. Out of 105, I think I got 26 interview invitations, but I only went to 13 of them. And with that, like in the beginning, I was like accepting all of them. But as I was getting more of the ones that I wanted, and once I started hitting like the invitation, I think when I started hitting at least 15 invitations that I accepted, I knew I could start accepting ones that I wanted to go to, and that I could, decline the ones that I didn't want to go to. So I started accepting them in locations where I was interested in. And then obviously I knew I couldn't afford to go to 26 different places. So, but I felt like I think as an IMG of having at least like 10, I heard that was fine. But I went to at least 13 because I kind of wanted to go to 15, but I was like, okay, I think it's fine. So I at least went to like 10, like to 13 of them just to be sure. But I think for IMGs, having at least 10 interviews is like the average what you should shoot for, and I was glad that I did a little extra.
Yeah.
That was good. And I went like my interviews were in. They're mainly where my so I'm from Texas. That's where I put my actual address in, and I got a lot of them from Texas and kind of just the general area like Texas, New Mexico. Also got California and Florida. So pretty much the general area. That's also why looking back, I applied to like randomly like Missouri and like Chicago area. I didn't even see myself going there, but I just threw the application there because I wanted to. Looking back, I probably would have just applied to less programs, and of course, like okay, yeah, maybe you get less interview invites, but you're gonna go to the places that you're gonna get invited to places where you're gonna be anyways. And I got pretty good invitations. I got good locations.
So you would say it wasn't worth financially and just kind of the time to apply to those places just to get over 100.
Yeah.
So if you're looking back, you would rather just apply to kind of
60 or
70 that you knew that you would, if you got into, you would want to go there.
Yeah, exactly. Okay. I probably would have just stuck with. I mean, instead of applying to like New Mexico and like and stuff, I probably would have stuck to like California, Las Vegas, Texas, and Florida. Because those are really the only places that I travel to.
Yeah.
Of course, like you feel scared when you haven't gone through the match and you're like, I need to apply this many, but because you're trying to reach a certain number. But in the grand scheme of things, like you can't apply to those and apply to some later. But think about it. Would you actually go to those places? That's what you should think about. Yeah.
That's awesome. And then one question about where you matched, was that your top school or top program?
That's interesting to say because when people talk about like their top program or their number one, there's a lot of strategies that goes into your rank order list. And just because something isn't like your heart and soul your first, it is your first. For example, for me, I put a different two other schools on the top because they were these big university programs. They had a lot of options available, and I wanted all the opportunities in the world to go there. And of course, one of them I've like grown up there, and I've always wanted to go there. So I would shoot myself in the foot, and I didn't at least try to go to the place that I've always wanted to go as a child.
Yeah.
So that's why those are my first two. Were they in my heart? Like I felt like I loved it there? Actually, no. They weren't on the interview, weren't exactly like as like warm and open. They're very structured university schools. Looking back, it's like they have all the bells and whistles of like all the opportunities, but in my heart were they my number one? No. But on my rank list they were. So my program was actually my third rank, but in my heart they were my first rank.
Awesome.
Even though they tell you, put where you want to go first, there's some people it's just strategy. But for me, with this program, just from the interviews, just how they were just so loving, you can tell they really cared about their residents. They treat all of their residents like family. The program director was super sweet and wonderful. Even in the beautiful area, I mean, it's California. The whole time there, I was like, what is the catch? It's a beautiful beach. It's a beautiful hospital. It's like all the people are nice. Like, what's the catch here? And of course, this program, they have no fellowships, but I still rank them three because I felt like just going there, I would feel more comfortable in my transition from student to resident than any other place. And honestly, whenever a match day came, I was so glad that the universe gave me what I really wanted. So yeah, that goes to show you, even if you do, that kind of alleviates some of the stress too when it comes to ranking, because no matter what you rank, you're gonna go where you deserve to go, where you're meant to go.
Yeah.
So as much as I put the other places first, I'm really glad that I didn't match there, because I probably would have been so unhappy, and I wish I could have just put this place first so that I can say, yeah, I ranked this place first. But to be honest, I didn't. But who cares if it's your number three or whatever? It's like where you're meant to go.
So before we end and leave here, is there anything that you want to tell M4 who's getting ready to apply? I mean, we're
Oh
about to apply as
yeah.
well now. Is there anything that you want to leave on to us that we should, some leaving words, some lasting
Leaving
words?
words. This is kind of interesting when it's July now, everybody's preparing stuff. Um, just like on, I guess, as far as like researching and everything, like I said earlier, make sure you're looking for programs that you actually do have like an interest in, and think about your application and how that's going to look to the program you're applying to. For instance, mine was very based on like working with underprivileged populations, like being more of like a community medicine role. Like think about your application and what your desires to do, and if that fits with that program, because that's going to fit with if they're going to offer you invitation and you're matching. That's what I would say for that. I would also say for interviews, just make sure to be yourself. I think with med school, I only went to the Ross interview. I didn't have the opportunity to have all these wonderful medical school interviews. But I think with medical school, the interviews, you're trying to always prove yourself there. When you're at the residency interview, they really care about who you are as a person. Of course, they'll ask you about your accolades or whatever, but they really want to see what type of person you are and see if you're the type of person that is going to work well with them. And then when you're at your interviews, make sure that you're asking questions about the day to day life. Don't try to look smart about, oh, asking the right questions. This is your time to know where you're going to live and how you're going to spend your time day to day. Make sure you're asking questions about what your life is going to look like with these residents for the next 5 years. Like how do they communicate with you when you're sick? Like um, how do they transition you when you're there? Like think about the question of like what your transition is going to be when you actually move there and start there as a resident, and what your day-to-day life is going to be there on the job. And those are the types of questions that you should ask when you're on your interview, with at least with the residents. So those are some of mine. But other than that, my last words, I know I talk a lot.
No,
I
you're
would just
fine. You
say,
can
you
just go.
guys, just, have faith in yourself and have self confidence, and you know, just know that you're doing this for the right reasons, and you'll be where you're supposed to be no matter what. But just keep having that drive, keep working hard. I know all the COVID stuff. I think you know in your heart if you're going to be a doctor for a reason, and I feel like it'll work out the way it's supposed to be. So,
Awesome,
yeah.
awesome. Well, Natalie, Dr.
Okay.
Gordon, thank you for taking this time out. Just having this little conversation and chat with us.
Okay.
The day in life of IM kind of medicine and the process of it.
Yeah,
We
of
really
course.
appreciate it. And for you guys tuning in, just like and subscribe. If you have any other questions, please
Yeah.
leave them in the comments. We have some more interviews like this coming up for you
Mhm.
guys. So that's all we have here on the Gosey Guide. Tune in next time.
Bye.